Thank you, Tricia, and everyone. Our time sequence for the program is a little bit out of whack, so I'm going to take the privilege of the podium and extend that even more. The event at the association is the annual meeting, and this award is presented every year. So those of us who attend are always in the audience listening and trying to understand as they read in sequence various accomplishments and attributes of the individual who was recognized. So it's secret. And so they were going through, and about halfway through, I said to myself, oh, shoot, that's me. And then I realized, now I got to go up to the podium, and I've got to think of something to say. And then I remembered, but wait, I haven't seen anybody from the hospital. They've really done a good job of hiding everybody. Because usually people from the hospital where the person works come, and family members and that sort of thing. So I made that long walk up to receive the award, and out comes Steve Phoebus. Where's Steve? Right here. Steve's our CFO. And I was so surprised. He lives in Arizona, and he's our CFO, but he was here. That is great. And then I said, where's everybody else? Well, I looked up on the screen, and they had Skyped in. They were just like big like that on the screen. And but they weren't tuned in because the people at the association didn't want there to be feedback, or if they were telling jokes, they didn't want their jokes to be coming over into, so they muted them. We couldn't hear them, and they couldn't hear me. So they didn't get to hear what I had to say. So I'm going to say it here. Leadership is not an individual endeavor. So I'm going to take an opportunity to recognize those who have been a part of a very incredible and personally satisfying journey for over 20 years. First, of course, is my wife, Sharon. And representing our 5 children, my son, Micah. I'm going to embarrass them and ask them to stand and stay standing, because eventually you're all going to be standing. So if you'll please stand. One of the things that I've looked back on and recognized was, I don't know that it was a conscious decision, but I've been willing to accept it and tout it as mine, that being a part of the leadership team that I've had the privilege of working with are 4 individuals who were already at Pullman Regional Hospital when I came. Steve Phoebus, Jeannie Eiler, Bernadette Burney, and Dorcas Herzl. Where's Dorcas? Guys, stand up. Okay. A few years later, a couple other folks, 3 other folks joined that leadership group, and they've just added additional capacity to what we've been able to accomplish. And Dr. Rich Caggiano, Megan Guido, and Bonnie Martin. Now, to further embarrass Bonnie, Bonnie is the one responsible for all these arrangements. We came up with the bright idea, and then we said, Bonnie, make it happen, and she has. So Bonnie, please come up. Then we've had the privilege of working with so many other great leaders and staff at the hospital, so I don't want to name them all off. I'd forget them, but if you're a member of the hospital staff, leadership, or other staff capacity, could you please stand? We've got members of our Board of Commissioners. We've got members of the Foundation Board. We've got volunteers, whether it's community volunteers or auxilians or student volunteers. If you're associated with any of those groups, could you please stand? We have an excellent group of physicians in this community whose leadership and commitment have been instrumental in whatever we've accomplished. So the physicians here tonight, if you please stand. If you've had a reason, or a family member have had a reason to use the services at Pullman Regional Hospital, would you please stand? And if you're a member of our National Board of Advisors, would you please stand? Folks, this is the leadership that makes healthcare in Pullman so special. Thank you for letting me have a part in it. And I was told I was supposed to acknowledge some Foundation Board members who are here tonight, so if they'd do the raise the hand. Ashley Allred. Ashley here. Fritz Hughes is here. I saw Fritz. Kay Ward. Linda Carey. Is Linda here? All right, thank you. Grateful to have those folks here tonight. Now we can move on with the planned part of the program. This recognition was planned, but what I just did wasn't. And so I'm glad I had a chance to give them back some of their own medicine. Am I on to my next thing? So why do we have a Health Innovation Summit? You know, we don't call it healthcare innovation because we really want to focus on health and what we can do to better provide opportunities for people in understanding, managing, and developing their optimal health. And how can we be innovative in that arena? It's been a strategic focus for Pullman Regional Hospital for many, many years. And it's a creative process. There's opportunity and innovation. And while that's been a part of our DNA, if you want to call it that, we see that we need to expand it. And so as a part of our vision for the future, and especially through the efforts around Community Health 2020 and what we envision happening, we want to strengthen our commitment to innovation through developing partnerships, through a collaborative effort within the community to draw upon the community resources, just as we've done for many, many years, to create what we have today in a solid, high quality, high patient experience healthcare system. And then we want to pay attention to how are we doing, and are there new services, are there new ways of doing things? Can we improve upon what we've been working on? And so tonight you've heard some of the stories of a few of the things that we're working on through the Copper Development Association and the antimicrobial properties of copper in helping keep infections in hospitals and other healthcare institutions down. We're working with the Friends of Hospice and our work around advanced care planning, and taking that significant part of our journey along health and helping people have a better experience and create a quality opportunity for that time in their lives. Gemini Systems is our partner for our telespeech. They were back here in the corner explaining how we can make a difference in access and cost and quality of speech therapy services through the use of technology. And Brian and Carrie will be talking about that in a few minutes. We've got another partner that we just started this year with the Palouse Knowledge Corridor. We've become a sponsor of their human health track in their innovation entrepreneurs boot camp. The Badger Brace is over here. Ed Robertson's one of our very own. Where's Ed? Right there. One of our physical therapists. And that's been a brainchild of his for probably 15 or 20 years, and now he's finally starting to see something come to fruition, and we're excited for him. And it's that energy and vitality that can bring other innovations to healthcare. We're partnering with Inland Northwest Partners as a way to reach out beyond the local Palouse region and identify connections that might help us discover new ways of providing healthcare and changing the way we do it. We see that quality is a continuing focus, and so we've partnered with a group called DNV for our accreditation and certification processes, learning now how to implement ISO 9001 standards into the quality work we do in serving the community. Empire Health Foundation out of Spokane has been a source of introductions, a source of funding, a source of inspiration for us as we've learned to integrate and collaborate with them in the work they're doing throughout the Eastern Washington region. Their subsidiary, Better Health Together, is involved in the State Healthcare Innovation Plan. And so we've been able to participate in the formulation of how that plan might actually impact the work we do here in Whitman County. And finally, with Providence Health and Services, we're looking at how we can partner with them for the establishment of graduate medical education residency programs here in Pullman, so that we continue to have the opportunity to be involved in the training and development of new physicians and raise the level of quality in our community, because all the people who are involved in education continue to stay at the top of their knowledge base and what they want to share with physicians and how they're trained. And so we see that as a great opportunity for expanding the capacity of our community. So the Center for Learning Innovation, which is part of our Community Health 2020, has, at the core of it, is the catalyst. It's a set of activities and energies that we put forward to try and address opportunities for improving health, lowering cost, and making the experience for patients better. That's known in healthcare nationally as the triple aim, and they're the core activities that we see happening as we continue on in developing the Center for Learning Innovation. Improving the patient experience, improving the health of populations so that our healthcare system is paying more attention to helping people stay healthy and understanding what that means, rather than only intervening when those efforts don't seem to produce the right results or if people are ignorantly not able to address them. And then at the same time reducing costs so that what we are able to provide is sustainable over time. In some examples in reducing or improving the patient experience, it's always a better thing to know that you're safe when you're in the hospital and that infections aren't something that you have to worry about. So our work with the antimicrobial copper, as well as the other efforts that we've undertaken in previous years, continue to make a difference in that patient experience. Robotic-assisted surgery is another. It's not a brand new technology, but it's new for us, and we've applied it in ways that now make the patient experience shorter stay in the hospital, less pain, less blood loss, quicker recovery, quicker return back to work. And that's been a great benefit for the region. And finally, the use of health psychologists is exploring and integrating the psychosocial aspects of healthcare into the medical delivery of healthcare, so that there's a more complete involvement of the patient and the physician and these extenders as addressing a broader scope of needs in the pursuit of health. Looking at improving the health of populations, we're now piloting the use of care navigators, working with the Human Development Department at Washington State University and their undergraduate students, and having them function in primary care offices to be a source where physicians understand that in order to be successful in managing a medical condition, a patient may need help with utilities or transportation or shelter, and these navigators can help bridge that gap where physicians don't have the time, maybe don't even have all the right connections to know how to effectively and efficiently get that done. We are actively pursuing a grant opportunity with the Washington State University School of Nursing and the Agency on Long-Term Care for Eastern Washington to work with vulnerable populations, often who are aging or have some disability, to see how through health coaching we can bring a more comprehensive approach to managing their health care and helping them with whatever chronic diseases they may be struggling with. And finally, our Palouse Area Health Network. Many of you here tonight are partners with us in the Palouse Area Health Network as we look with, and we've just received grant funding a month ago from HRSA to put a strategic plan together for 5 years of how we can identify and then address gaps in health care for women and children in our region. And finally, as we look at reducing cost of health care, we have pilot projects going on around how might group appointments for identified diagnoses help be a more efficient, effective way of providing medical care and support for patients with specific illnesses. We have a group of staff who are looking at the role of in-home visits as a way to reduce the cost of health care, because if people leave the hospital and then they can be more compliant with whatever regimen they've been recommended for them, and we can fill in where their knowledge deficit may be, then there's a greater opportunity that they won't return to the hospital or have to have additional care because they missed some important part of their after-hospital care. And finally, telemedicine, which you'll hear a little bit more from Carrie and Brian. How does telespeech work? What about in emergency situations for telestroke services in connection with specialists in Spokane, which we implemented over a year ago? And still looking at the role of telepsychiatry is reaching out into outlying areas around Pullman for how we can bring mental health care to those that may have less access and make it less costly so that they don't have to leave their homes, they don't have to find child care, they don't have to attend to other things or miss work in order to receive important mental health services. Oftentimes we are told that there's a crisis in American health care, and this probably isn't a new set of characters for you, but you may understand that in Chinese, the word crisis is made up of one character for danger and one character for opportunity. And while there are certainly some potential areas for concern, there's a lot of opportunity as we look to innovation as an engine to help us achieve innovative ways of addressing the health of our community and the healthcare needs of our citizens. So tonight, we begin a community conversation, and you'll hear from Brian and Carrie about the great possibilities in the use of technology for addressing one specific disease or area of concern in speech pathology. But you'll hear Craig Dolezal, our key presenter, talk about the opportunities that can be out there as communities come together and begin to say, what is it that we want for healthcare in our community? It's going to change, and if we're not having that conversation, we'll simply be responding to what others tell us it's going to be. But we have an opportunity, and so tonight is a gathering to begin that conversation and to extend an invitation, which will come at the end of the evening, for how we can bring this together as a community. Creativity requires the courage to let go of certainties. And I think we're at that point in the development and transition of healthcare in America. We probably need to let go of some of our certainties and ask about what are the possibilities. Thank you for being here tonight.